Hello and welcome again. We were on bacterial exotoxin and we were on page 132 of USMLE Step 1 2021, and we were talking about the bacterial exotoxin, in which we have talked about what are the exotoxin that acts by inhibiting the protein synthesis. Among them was Corynebacterium diphtheria, Pseudomonas aeruginosa, which was inactivated in elongation factor 2. Then there was a Shigella species and Cigatox enterohemorrhagic E. coli that is causing the cigatoxin and Shigella toxin, inactivating the 60X ribosomal subunit that is inhibiting the protein synthesis group. Then there was another group that increased the fluid secretion by cyclic AMP, which is the synonym of remembering those bugs like C for cholera, A for anthracis, M which tilting becomes enterotoxigenic E. coli, and P for Bordetella pertussis. So we have talked about this. Now there is another group of another group of bacteria that release those exotoxin, which are the potent one that release outside and causing the severe damage. You have heard about the Clostridium tetani causing tetanus, and then there was the Clostridium botulinum causing the botulism, which has the different types like infant botulism and foodborne botulism. We'll talk about it. So how this group of exotoxins are acting? These are inhibit the release of neurotransmitter. So these are the exotoxin that release into the neurological synapse, and then they inhibit the release of the neurotransmitter. Neurotransmitters are the hormone-like substance that are present in the central nervous system, the functioning of the proper transmission of the neurological signals. Once these neurotransmitters are not present, then there will be the devastating complication. There will be no transmission of signal, there will be no control of the central nervous system to the peripheral nervous system, and there will be the damage part occurs. Let me explain you. This inhibit the release of neurotransmitter are the two bugs, that is the Clostridium tetani and Clostridium botulinum. The Clostridium tetani release the exotoxin, the toxin known as the Tetanospasmin, whereas the Clostridium botulinum release the toxin named the botulinum toxin. These two toxins both are the enzyme proteases that cleaves the protein. So these are the proteases. This is the enzyme that is the enzyme that cleaves the protein. So they can digest the protein. So these are the protein digester. So what type of protein they digest? They digest, they cleave the snare protein, SNARE, snare protein. What is snare protein? These are the soluble NFS attachment protein receptor. So these are the receptor, a set of protein required for the neurotransmitter release via vesicular fusion. So let me explain what is going on. And in the neurological synapse, there needs to be release of neurotransmitter. How this neurotransmitter is released? By vesicular fusion, and then comes to the neurological border to release those neurotransmitter. These are the proteases that cleave this snare protein, which is a receptor that help in the fusion of the vesicular fusion. So neurotransmitter release when vesicles are fused. Vesicle fusion occurs when this snare protein helps in the attachment. Once that snare protein is not there, so there is no vesicular fusion. So there is no vesicular fusion, there is no neurotransmitter release. So there is no neurotransmitter outside, then there will be damages. What are the damages that occur? The neurotransmitters like tetanospasmin if there is present, that inhibit the release of the neurotransmitter. What are the neurotransmitter? That is the GABA and glycine. This GABA and glycine. So these two neurotransmitters are inhibitory neurotransmitter that actually control our nervous system, lower motor neuron. That is the peripheral, you can say lower motor neuron, or you can say peripheral nervous system, they are controlling it. If these two inhibitory and GABA glycine, why they are not present now? Due to the presence of this tetanospasmin. Why this tetanospasmin has come? Because that person has got infected with Clostridium tetani. So there was a release of tetanospasmin. This tetanospasmin has cleavage this RENSA protein in RENSA cell in the spinal cord. You have to remember this. This is very important in the USMLE point of view. This RENSA, you can see this RENSA cell. This RENSA cell. This RENSA, you can let me explain you very clearly. Actually, these are the toxin that prevents the release of inhibitory GABA and glycine. So this GABA and glycine has been prevented. Why they have prevented? I have explained you. Since these neurotransmitters released from the RENSA cell in the spinal cord, this RENSA cell has been now damaged due to the presence of tetanospasmin. Why tetanospasmin came from? Because of the Clostridium tetani, and the patient has got infected with the Clostridium tetani. So tetanospasmin, that toxin is released inside the cell that has been transformed into the neurons, and that has prevented the release of neurotransmitter by preventing the fusion of the vesiculars. And since there is no vesicular fusion, there is no neurotransmitter. Which neurotransmitter are not there? GABA and glycine. Why they have not came out? Because they are released from the Rensa cell in the spinal cord, and that has been cleaved, that is with proteases, that has been break down by this tetanospasmin. So no Rensa cell, no due to tetanospasmin, no Rensa cell, there is no release of GABA and glycine. Now, since the GABA and glycine is not present in your neurological synapse, they are not present, what they cause? They are actually inhibiting your lower motor neuron. Since they are not inhibited, now their action has become profound. So lower motor neuron, without proper guidance, now it has been acting rapidly, and that causes spastic paralysis. You have to know the difference between the spastic and flaccid paralysis. The spastic is a tight, the tone has increased because the contraction has increased. The upper motor neuron, which was trying to suppress those things, was always controlling your lower motor neuron. Now that has been gone off, that has been cut off, because this inhibiting GABA and glycine has not been present there. So there is no inhibition, there is no proper control of the lower motor, and so there is a paralysis because now the reflex arc is not present. So it is not sending any that signal has not been controlled from your central nervous system. It has been cut off, but the lower motor neuron has been acting fast, acting more, and because of that has become spastic paralysis. If it is due to the lower motor neuron lesion, then that will be a flaccid paralysis, no action. But this here is the tone has been increased. It is a paralysis, but their tone has been increased. So there is the spastic paralysis. There will be a facial muscles get spasm. So there will be the rhizus sardonicus. Then there will be a trismus. The jaw will be locked, and there will be the opisthotonus, like the bending of the back muscle. So it will take the like a bow appearance. It will be, if you can see, this is the portion. Okay, sorry. So this back muscle, the back muscle get bent, and the person will be like this. So this is the bending of the person. This becomes the bow, arrow and bow you have seen. So our own body, this become like this one. So this will come forward and it will bend like this. So due to the spasm of the back muscle. So this all occurs because the neurotransmitter which are controlling the lower monitor, that is GABA and glycine, is not present. Why it is not present? Because it is not released from the Rensa cell in the spinal cord. Why Rensa cell was unable to produce it? Because it was been damaged. By whom? By tetanospasmin. Where does this tetanospasmin came from? It came due to the infection by a patient with a Clostridium tetani. I hope you got this point. Now let's come to the point of we were on this release of Clostridium tetanospasmin causing that is near protein cleavage, that is the Rensa cell, and there is no inhibitory GABA and glycine, and causing this spastic and spasm of the extensor muscle, back muscles you can say. Now comes to the Clostridium botulinum. Again, the botulism, these both are the Clostridium anaerobic organism, same group of organism. It produces the botulinum toxin, and this botulinum toxin has release that cause the cleavage of this protease that prevent the release of neurotransmitter. Since there is no neurotransmitter, there will be flaccid type of paralysis. This is actually related to the acetylcholine. So this will be a flaccid type of paralysis, and the patient will develop two types of disease, that is the infant botulism and foodborne botulism. In infant botulism, a person, a baby in the Asia, normally in Asia and other countries, we have found that when a baby is born, they have the tradition to give the honey to them before the breast milk. So this is just old traditional or social stigma. So if that honey contains the spore of this Clostridium botulinum, this go inside your body, that infant, into the intestine, where this spore gets germinated from the Clostridium botulinum. From that they release the botulinum toxin, and cause the baby a disease known as the infantile botulism. What happened? Caused by the ingestion of the spore, example from the soil, raw honey, and the toxin are produced in vivo, that is in the intestine, and then cause the symptoms of infantile botulism. So there will be this botulinum causing the paralysis, that's the flaccid paralysis inside the intestine and if into the systemic circulation as well, and there will be the disease called infantile botulism. There will be another form of botulism that is called a foodborne botulism, where a bacteria is the spore or a bacteria has already entered inside your food, that caused by ingestion of the preformed toxin. So once the bacteria is already in the canned food or the spore that gets germinated, now bacteria has come out that release this toxin, botulinum toxin, and it is already in your now food in a preformed form, in a pre-released form. When you ingest it, you will develop this foodborne botulism. There will be the foodborne poisoning of foodborne botulism because the toxin is already present in your canned food. Because the bacteria is present, the bacteria release the toxin, and the toxin is in your food. Now if you eat this food, you will develop the foodborne botulism. And this toxin is opposite to that of tetanospasmin that cause the spastic paralysis, whereas botulinum toxin is causing the flaccid paralysis. If you remember, this small amount of botulinum toxin in the supermodels they used to inject into their face to keep the muscles tight. What happened when you inject a small amount, there's release the toxin, inhibit the release of this acetylcholine, and then it causes the flaccid paralysis. Because that the wrinkle get disappeared and the models looks more beautiful. Even in the old days, the great queens they used to do that. So these are the way of this is a beautiful beauty product as well, but it is harmful because if the dose become larger, then whole face get paralyzed, and that you have to understand. Everywhere in the toxin you have seen that the A portion is given there. A is indicating that there is a two part, A and B. B is for binding, A for the active component, A enter inside our cell and then they activate this thing, and all the system, all those action takes place. Like A had to help in the, I have told you in the case of the cyclic AMP, this A is the active product that enter inside the cell, then activate the adenine cyclase, which cause the increase of cyclic AMP, and this cause the all other symptoms like increase of the water and chloride efflux from the body. So this all A has indicating that every toxin, exotoxin has a two component, A and B. B stands for binding, that is bind to the receptor. A enter into the cell and plays the active role in activating all those component, all those mechanisms. Thank you.